opportunity to help patients improve and reach their maximum potential. In our treatment approach, we are promoting symmetry by helping patients learn to integrate the weak side along with the strong side. This can start early on, as soon as the patient is first seen at the hospital. While resting in bed, most patients are positioned in supine. This is okay, but the most therapeutic position is side lying on the weak side, so we want to make sure it is included on a daily basis. Here we have Harriet, who has had a stroke and now has a left hemiplegia. There are many advantages to positioning the patient on their weak side. They become more aware of this side due to the increased sensory stimulation. By lying on a protracted scapula, it can help prevent painful shoulders as well as reduce the increased tone inflection synergies. This often occurs during recovery. And by having the patient positioned in this way, it allows the strong side to be free to reach for objects from the nightstand. In addition to bed positioning, just how the bed is positioned in the room can add even more opportunities to increase function and awareness of the weak side. I like to have the nightstand positioned on the weak side, so it encourages the patient to turn in that direction. Each time she reaches for the phone, she has trunk rotation with weight bearing on the involved side. Because she needs to find the phone or the water pitcher, the stimulation on the weak side helps her turn toward that side, decreasing neglect and learning to compensate in the case of a visual field cut. The only exception I make is to be sure the call light for the nurse is on her strong side, in her visual field, so she can reach it easily and quickly.
Hi, Mom. How are you doing today? You're looking great. Yeah.
I also like to have the bed situated in such a way that the weak side is toward the door. Friends and family as well as therapists are more likely to approach the patient from their weak side, encouraging and improving awareness of that side.
Almost did it.
You did. You moved your thumb. I just saw you do it. Can you feel that? Could you feel that you did that?
Mm-hmm.
That's wonderful.
That's what so surprised me.
See what you can do.
Yeah.
So do you want to look over here and see if you can uncurl these at all? Can you uncurl them so that they aren't so stiff? Look at that. That's great.
Yeah.
That's great.
As our patients are able to sit up, I want to make sure that their involved arm is well supported on a surface. That means that the entire forearm is supported, up to the elbow. Be careful that the arm is fully supported because a heavy arm resting half on and half off the table can not only cause discomfort, but could possibly cause problems with ulnar nerve compression. It can be placed on the bedside table, the counter along the bathroom sink, on the wheelchair lap tray, or on the dining room table. By having their arm on a surface, it helps to support the trunk in a more symmetrical position. The patient is less likely to sit